Scientists in Japan are now conducting human clinical trials on a drug designed to regrow teeth from your own body. This treatment aims to trigger the growth of a natural tooth, which could eventually replace our reliance on titanium implants. The potential patient base is massive. In the United States alone, over 120 million adults are missing at least one tooth due to injury, decay, or the natural progression of aging. For those millions, the current medical standard is a mechanical one. It involves drilling titanium screws into the jawbone and attaching a ceramic crown. These procedures are invasive, often costing between $3,000 and $5,000 per tooth, and they carry inherent risks of infection or the body simply rejecting the hardware. While implants have been the gold standard for years, they remain a mechanical fix for a biological problem, one that requires a lifetime of maintenance and eventual replacement. Recent research suggests that humans actually have the internal capacity to grow a third set of teeth. This capacity lies in dormant tooth buds located within the jaw. These are clusters of leftover cells from the period when your baby and adult teeth were first forming. These cells are not dead or missing, they are simply inactive. Once our permanent teeth are in place, our bodies produce specific signals to keep these buds from developing any further. The challenge for researchers isn't creating something new from scratch, but finding a way to reactivate this existing biological blueprint. The process for unlocking that growth began with over 20 years of foundational genetics research, all happening at Kyoto University. Researchers identified an RNA protein called USAG1 that acts as a suppressor. In this molecular model, you can see how the protein functions like a biological brake. Specifically, USAG1 blocks bone morphogenetic protein signaling, the vital pathway your body uses to develop a tooth. As long as this protein is active, the growth signal can never reach the tooth bud. To bypass this, scientists developed a drug called TRG-035. It's an antibody delivered via localized injection that binds to USAG1, neutralizing the brake and finally allowing those growth signals to pass through to the dormant cells. By identifying the specific protein that stops growth, researchers have found a way to let the body's natural regenerative cycle finish what it started. Once the suppression is lifted, a complex biological reaction begins. Stem cells known as CXCL12 are drawn to the newly awakened tooth bud. These cells begin constructing a natural tooth root, integrating it directly with the jaw's existing network of nerves and blood vessels. This process was validated through extensive animal testing. Success began with mice and moved into ferrets and finally dogs. These animals were selected because their dental biology is similar to our own. In these trials, they successfully grew new, functional teeth with no significant adverse effects, providing the necessary evidence to move toward human testing. Because this mechanism worked reliably in large mammals, the research team was cleared to begin the first human clinical trials. Those trials are happening right now. Phase 1 began in late 2024 at Kyoto University Hospital and is scheduled to continue through 2025. This first phase is strictly about safety and dosage. The drug is currently being tested on healthy adult males who are already missing back teeth to ensure there are no unintended reactions. If the safety data is positive, the next step is Phase 2. This will involve treating children between the ages of 2 and 7 who have congenital anodontia, a condition where their permanent teeth never develop due to genetic factors. The researchers are following a specific pipeline that prioritizes safety and severe genetic conditions before the drug can be approved for general use. The current goal is to make this treatment available to the general public by 2030, specifically for patients who have lost teeth to decay or injury. Initial estimates suggest the treatment could cost roughly $11,000 per tooth. While that is more expensive than a single implant today, the diagram shows how it compares to the lifetime costs of maintaining, repairing, and eventually replacing artificial hardware. If the long-term data proves that these regrown teeth are as durable as natural ones, this biological approach could provide an alternative for those who currently rely on the implant industry. If these trials continue to show success, the focus of dentistry may shift from providing artificial replacements to facilitating biological repair. To follow the future of regenerative medicine, subscribe to Vitality Protocol